Hi, everyone. Welcome and thank you for joining. My name is Sydney Cooper. I'm the events moderator here at Health in Her Hue, and I will be your host today. Our community conversation today will be focused on breast cancer treatment and survivorship for people under 40. As a reminder, Health in Her Hue is a digital health platform that connects Black women and women of color to culturally sensitive healthcare providers and offers health information and content that centers their lived experiences. Drop where you're joining us from in the chat because we have a very, very special guest with us, a returning Health in Her Hue provider. Today, we have the brilliant Dr. Rylan Gore. Dr. Gore is a board certified, fellowship trained surgeon who specializes in the diagnosis and surgical treatment of benign and malignant breast disease, as well as breast related disorders. As a highly trained physician skilled in advanced breast surgery procedures and minimally invasive techniques, Dr. Gore treats each patient with the highest standard of care, serving them with compassion and empathy. A native of Atlanta, Georgia, Dr. Gore grew up in nearby Stone Mountain and received her undergraduate education from Furman University in Greenville, South Carolina, graduating cum laude. She then received her master's in public health at the George Washington University School of Public Health and Health Services in Washington, D.C., before returning to Atlanta, where she completed her medical education at Morehouse School of Medicine, graduating cum laude. Dr. Gore then completed her residency in general surgery at the Rush University Medical Center and John H. Stroger Cook County Hospital in Chicago, Illinois, before completing her breast surgery oncology fellowship at Maimonides Medical Center in Brooklyn, New York. Excuse my pronunciation if I got any of that wrong, but welcome and thank you for joining us, Dr. Gore.
As always, thanks for having me.
Okay, so we have a good amount to get through today. So I do want to jump in, and I love our discussions. But before I put you on the spot, I just wanted to remind our audience members that although she is a medical provider, today's discussion should not be taken in as medical advice. So please seek personalized care, for any individual concerns. Also, please note that some of what we're going to discuss today may be of a sensitive or triggering nature, and we ask that you please do whatever you need to do in order to take care of yourself. During that discussion, please feel free to use our chat feature here on the right side of your screen to share any comments or questions that you have. We will have a brief Q&A towards the end of tonight. All right, now that we have all of the housekeeping out of the way, let's just jump right in.
Mhm.
We often hear that getting breast cancer before your 40s is rare, and that if it does happen, people assume it must be hereditary. But most breast cancers have no hereditary component, and peer reviewed research has come out with strong evidence that shows a statistically significant increase in breast cancers among women younger than 50. What do you think is contributing to the increase in breast cancers in young people when most breast cancers have no hereditary component?
So I think this is a combination of things, and I always like to say nature versus nurture. It's not just one thing. Regarding more cases being diagnosed under the age of 50, I got to say that our screening techniques and our recommendations have gotten better. And so the better the imaging gets, the more likely it is to pick up on something. And the truth of the matter is, women are doing a better job, especially Black women, of actually getting their screening mammograms every single year. And so, the old research, they like to say, oh, Black women are doing worse because they don't get their mammograms. The opposite is actually true. And as of 2021, the uptake of screening mammograms, Black women have outpaced white women and other women. Upwards of 80% of women are getting their screening mammograms every year. But to get back to the main subject at hand, I think the reason why it's younger and particularly why Black women fare worse, I think um, not just picking up on more advanced disease earlier, but I also think systemic racism. We do know from the research and the literature that from screening all the way to survivorship, Black women fare poorly compared to their white and other counterparts. I think there are so many social issues that go into that, including who's likely to have no insurance or public insurance versus private insurance. I think we also have to think about where women frequent and where they access their health care, and do they have qualified people providing their health care and who are going to make the appropriate recommendations and referrals. And that's unfortunately something that we as Black women have to think about. I also think that um, some of the things that we do, some of the rituals that we have contribute. So, for example, self care, like our hair is very important, right? But what about our hair products? What's in them? What's in our shampoos, our conditioners, our relaxers? I have already come to grips with the fact that I might be increasing my own risk because I have been getting relaxers for years, and I just understand that that might be a part of my risk. Black women and other minorities are more likely to live in areas where they are around nuclear plants, other areas where there's dumping. Um, so environmental justice is a huge conversation when it comes to cancer care and not just breast cancer. And then the other thing I worry about that we don't talk about a lot is our food and what's in our food products and how does that contribute to our overall health, not just obesity and other chronic diseases, but cancer.
Yeah,
So sorry, it, answer, but it's really a multifaceted situation.
yeah, for sure. I feel like you touched on almost all of the social determinants of health, which of course are always impacting Black women. Like, we just have to be so much more on top of it. I'm really happy that you touched on hair and food specifically, because for us culturally, hair is very big. And I think that culturally, we're not going to stop doing certain things just because there is a risk associated with it. And then food, access wise, some of us can't stop doing certain things because there is a risk associated to it. But I really love that you highlighted that we are still increasing how much we're getting screened, which is that's like the bright light in all of this, because
Mhm.
although we may still be getting it, hopefully we're catching it a little bit earlier as well.
Absolutely, absolutely. But we still have to contend with issues of not being believed. If you
Mhm.
do actually show up with a complaint, I think it's so important for the crowd to know that if there is a complaint, screening mammogram goes out the window. You need a diagnostic where the images are evaluated on the same day and you get a report. And if any additional images need to happen, it happens. So I always say, if you feel something, say something. That's huge.
Yeah, yeah, and if you find I'm sure we'll get into this later in the discussion as we always do, but, like, if you do feel like something's wrong and you don't feel comfortable with your healthcare provider, like, Health in Her Hue is working to kind of fix that, so awesome. Okay, so with older folks, breast cancer diagnoses are kind of accepted or expected. But when people are in their 20s and 30s and they bring concerning symptoms to the attention of their healthcare provider, unfortunately, they may be subject to clinicians downplaying some of their concerns or implying that they're too young to get breast cancer. What are some of the psychological effects of getting an early onset breast cancer diagnosis and then the potential medical gaslighting that precedes it?
It can be devastating, and the very definition of gaslighting is being told over and over and over that you are not experiencing something that you are truly experiencing. And so to witness it firsthand, especially at the height of COVID, I feel like that's not talked about enough in how all attention and resources went to COVID, but real medical issues were still happening. And so those patients being dismissed over and over and over again. And so I have a young lady who I took care of during COVID who went to the ER um, 3 or 4 times during the height of COVID and was told nothing was wrong. They kept giving her antibiotics, telling her she had an infection, even though she's not breastfeeding. She doesn't have any bug bites. She doesn't have anything that would give her an infection. And she actually ended up having stage 3 breast cancer in her early 20s. And so this is very real. It's something I take very seriously because, as you can see, it leads to delays in diagnosis. And it really impacts treatment and it impacts the patient's overall survival.
Yeah, wow. That I mean, to be in your 20s and to be dealing with something so scary. And I think sometimes also when we get certain diagnoses, we as Black women might gaslight ourselves. So it doesn't necessarily help that the people that we're going to and trusting with our care are like, oh, it's not that bad, or like the likelihood of this is not as high as you think it would be. And then all the while, this is during a global pandemic. Global
She
pandemic
really
is
thought she was
redundant.
going crazy, and then I
Yeah.
met her, and I was like, "Yeah, no, like, no, like,
Yeah.
stop, like, it's time to get things into motion," and so, I know we're gonna get on this later, but if you are feeling that way, you're feeling completely dismissed, you're feeling like your, physician or other healthcare provider is condescending, you're feeling like you are not being heard, things aren't being taken seriously, go to somebody, get another opinion. I
Yeah.
mean, and I know we press often, and that's one thing me and Health and Her Hugh are really aligned on is just advocacy
Yeah.
for, especially for patients of color.
Yeah. And speaking of advocacy, in the previous question that I asked you, just around understanding that there are so many more factors that are contributing to a younger diagnosis, do you think that more doctors are becoming aware of this and that like people are getting diagnosed younger? So hopefully that'll start to combat some of the gaslighting?
I think so. I think so. And it helps, I'm from Atlanta, and so it's easy to find a doctor that looks like you, but um it's harder in some other cities, and so I think that's where organizations like Health and Her Hue are so important. But I do think that people are getting better at understanding, like, wait, this is affecting younger people, and the research is there, and the disparity research, especially when it comes to breast cancer, is very robust. And so, if you're not seeing it or if you're not believing it, it's honestly because you don't want to, because
Yeah.
it's happening.
Okay. Yeah, all right. Well, then hopefully that makes some of our audience members more comfortable with kind of pushing past the first no if they get a no, or pushing past the first instance of gaslighting and like really trusting their gut and knowing that they know their body.
Yes.
Um I know that the healthcare system can be really difficult to navigate, but like this is our life that we are dealing with. So,
Which is why I'm a huge proponent of second opinions. It's like if that one relationship isn't working, because it really is a relationship with your physician, whether it's your primary care or OB or the person that ends up being your surgeon, you have to curate a healthcare team that you feel extremely comfortable with, because this is your life.
yeah. Oh, yes. Hopefully, people can find more providers like you, Dr. Gore. So, yeah, just really appreciative that you are even opening up this conversation because it's one that needs to be had. Okay, so treatment for breast cancer varies greatly depending on the subtype of breast cancer and how much cancer is present when detected. Can you give some examples of how active treatment for breast cancer in someone who is under 40 might look different from treatment for someone who has been diagnosed with breast cancer at an older age?
So for the most part, I can say that almost, I don't want to say 100%, but the overwhelming majority of my patients who get a breast cancer diagnosis before the age of 40 will get chemotherapy, unfortunately. Black women, and especially young Black women, are more likely to be diagnosed with the most aggressive form of breast cancer, which is triple negative breast cancer. For those that don't know, we look at three things. We look at the tumor receptors on every single cancer. We want to know, does it express the two female hormones, estrogen and progesterone, and does it express another receptor called the HER2 receptor? If all three of those are negative, that is called a triple negative breast cancer, and is considered particularly aggressive and more prone to recurrence. And so, especially in those cases, but almost all of my young patients end up with chemotherapy. And so, as you know, the side effects from that, namely driving a patient who's premenopausal into early menopause. And a lot of times, those patients do not regain their ovarian function. And another big thing, you have the hair loss, right? You have the psychological effects of the cancer diagnosis, especially at a young age. You think about the lifespan, knowing that, I mean, your 20s, 30s. And so your lifespan is still long. You have another 30, 40 years ahead of you. And so coming to grips with what a surgical decision is going to be because of the fact that that's a long time for another cancer to come back. And then something that we do not talk about enough is fertility preservation. And what are we going to do for those women who still want to have a family in the future? And how do we safeguard that?
That is a lot to consider. You're so right. I think there's a lot of things that you don't necessarily have to think about if you get diagnosed older, but if you get diagnosed younger and then you're cured, you still have the rest of your life. Like this is just a segment of your life that you're dealing with a
Yes.
disease that could alter a lot of your future decisions.
Older women, they're more likely to have these small, slow-growing tumors, and so a lot of them can get away with the lumpectomy,
Okay.
plus or minus their lymph node biopsy. Radiation, even though there are, some patients where they are able to completely avoid a radiation, and then sometimes they just take a pill for 5 years in max, and that's it, and so the trajectory is way more direct for older patients, because they are more likely to have the least aggressive tumors, and so they've already had their kids,
Yeah.
um, and so that's the difference. I think that the young patients have to deal with so much more, and they are more likely to get everything thrown at them, especially chemo, because they're younger and their bodies can actually handle it, and they're less likely to have other comorbidities that would make chemo fatal.
Got it. So even when you were talking about, this is your life, it's good to have the right team tackling these healthcare issues, especially one as big as a breast cancer diagnosis. Just thinking about all of the things that you might have to deal with if you're diagnosed at a young age and then you receive treatment for that diagnosis, I imagine you would need more than just your surgical oncologist on your
Absolutely,
team. Like,
absolutely. You're going to have a whole crew. you,
yeah,
you're going to get so sick of doctor's appointments. Um, at the very least, you're going to have the surgical oncologist. So that's what I do. I do the breast cancer surgery. A medical oncologist, they're the ones that do chemotherapy or the pills or both. Um, Radiation oncologist. You're going to have some gynecology or reproductive endocrinology person on board if you choose to do egg preservation prior to starting any treatments. And so they're going to be involved. And then I just think it's a good idea. Not every medical center has a psychiatrist or psychologist who specializes in oncology. If you do, that's great because they are worth their weight in gold. But if you already have a therapist or some kind of mental health expert that you work with, I think that's absolutely important during a cancer journey. And then there are the other people that you add as needed, such as, dietitian, physical therapy, or whatever. So it ends up being like this whole crew of people. And then your life for a short while just becomes a blur of doctor's appointments, but everyone really is necessary to make sure that it gets taken care of.
yeah, because I mean, we recently had a talk on menopause and like how that impacts older people. If you have early or if you're like kind of transitioning into menopause or that phase earlier in your life, all of like the mental implications of that, and on top of having a cancer diagnosis, on top of having to think 10, 20, 30 years in the future about like, do I want kids? Am I going to be able to have kids? And again, we'll probably get into this, but even like dating after breast cancer, that's a lot.
Cool.
Yeah. I
Yeah,
mean, dating is already really hard as it is
I heard
without cancer. So I'm just
in
like,
these streets, but dating after, I know we're jumping around, especially for those who are in the crew, but like dating after a breast cancer diagnosis is absolutely brutal
yeah,
for a lot of my patients. I've had patients, it sucks, especially when they're older too. They've been married for years. I've had patients get divorced after a cancer diagnosis. I've had partners who've left patients after a cancer diagnosis. I think across the board it's very difficult. And so, especially with young women, you're just getting started in your dating life, right? And now you've already had to make a decision about your breast reconstruction. I will say that a lot of my young patients do choose to get bilateral mastectomies to try to do everything they can to prevent it happening again in the future. But, what does that mean for your own sexual health, right? Like, because most patients don't have nipples anymore. If you were able to save your nipples, they probably don't have sensation. Your breasts probably have no sensation. And then breaking this news to a new partner or somebody that you're dating, it's a lot.
Yeah. I can only imagine. A healthcare team is always, always important, and, like, finding somebody that, like, or multiple somebodies that have your best interest at
Yes.
heart and are just, like, very knowledgeable about the mental and physical aspects, life-changing, I'm sure.
Yes,
On
absolutely.
a somewhat related note,
Yes.
young women and people that were assigned female at birth whose breast cancer hormone, positive whose breast cancer is hormone positive will likely have to go on an anti-hormone therapy to lower the chance of reoccurrence. How do they cope with the physical side effects of this treatment at such a young age? And what do doctors recommend for them in order to reduce side effects and improve quality of life?
So the biggest one with the hormone blockers. So there's two things you can do for premenopausal women. You can be on tamoxifen, but the numbers are better with aromatase inhibitors, which is the medication that we give postmenopausal women. And so the way to circumvent that is that we'll suppress the ovaries and then give the hormone blocker, the aromatase inhibitors, just because those are two different pathways of blocking the hormones. And so it's been shown that the aromatase inhibitors are slightly better. So the biggest one is the hot flashes, the flushing, which can be a lot. And so there are medications, for example, Zoloft, some of the other um, antidepressant medications. So it works, it helps with the depression and some of the symptoms that come
Mm.
along with that, but it does help with the menopausal symptoms as well. There are natural things, but the studies are pretty shaky on whether they actually work or not. But some patients do like to try, black cohosh, for example, and some of the other natural supplements. I do caution patients on some of the natural supplements just because they're not regulated. You don't know where things are coming from, if they work. Are there any additives or anything that can cause other issues? And so I tend to tell the patients to do antidepressive medications. The other big one that can be very problematic when you shut down estrogen creation is vaginal dryness and vaginal atrophy.
Mm.
We don't talk about, and that can be a real problem because that can eventually lead to recurrent UTIs and things like that, because of the tissues and how they basically atrophy and degrade. And so for atrophy, big fan of dilators and pelvic physical therapy.
Mm.
So that should definitely be in your arsenal. And also some of the more water-based lubricants, Replens, Uberlube is a favorite in the medical community because it's water-based, stays slippery for a while. Um, and some of these things, especially Replens, can help with moisturizing and keeping the vaginal tissue moist so that it doesn't atrophy as much. And so, even if a patient isn't sexually active, we tell them to still use these things anyway for general vaginal health and vaginal care. One thing that patients will ask for is, for example, Vagifem, which is a capsule, I guess, that contains estrogen, but it's local to the vaginal area only. There are studies to suggest that it doesn't get uptake into the blood as much because that is something we worry about giving a patient estrogen when they have an estrogen positive cancer and potentially feeding a recurrence. So that's something you need to talk to your medical provider about if that's something you're interested in.
How long are people typically on anti-hormone therapies? Because I know it's to prevent reoccurrence, but is it something once you start it, like, you're
No,
on
this is
it?
not like blood pressure medication where you just
Okay.
on it forever. It is like 5 years. There are studies suggest that there's even a greater benefit if you do it for 10 years versus 5 years. So patients do, and it just depends on how long they're able to honestly handle some of the side effects if they are having side effects, but at least 5 years. It's
Okay.
not forever.
Okay. Yeah, because those side effects are kind of brutal, like
A lot. It's a lot. And hair thinning, we don't think about how estrogen helps with other things, but some patients do experience mood swings, hair thinning. It's a lot.
yeah, that is a whole lot. Again, on top of cancer.
Right.
Yeah, that's okay. So yeah, this is like even more this is adding even more emphasis to why it's so important to have a team because this is not just like quick chemo and you're done. Like you're
Right.
literally over here planning what you're going to do with your eggs and fertility if that's something that you want to maintain.
Yes. And for those who, decide to go the genetic testing route, first of all, it should be offered to everybody who gets a breast cancer diagnosis. But there truly are some people that don't want to know. But if you are at increased risk because of a genetic mutation, specifically BRCA1 and BRCA2, we know that massively increases your risk of breast and ovarian cancer. The fertility preservation conversation becomes more important because it is recommended for BRCA carriers that their ovaries are removed at the age of 40.
Wow. I did not know that. And we have done
And
other
that they
talks.
finish,
Oh, go ahead.
yeah. Oh, I was going to say, and that they finish their childbearing, and after they're done with childbearing, whichever comes first, 40 or you're done with childbearing, you get your ovaries removed.
Okay, got it. Got it. Okay, that's really good to know. And again, we're talking about people under 40. I know people that are still having kids at 40. Our generation's having them later and later, so it's like, yeah, cancer
But yeah,
earlier, kids later. It's just things are very interesting right
yeah, the
now.
world is messed up right now. That's
Yeah.
super backward. Yeah.
Yeah. Okay. So you've gone through all of your treatments. You've worked with your team. What does survivorship with breast cancer treatment look like? And what are the follow up considerations that must be made for younger people who potentially still have several decades of life left?
Mhm. So for those who, if you're under the age of 40 and you've been diagnosed with breast cancer, you're high risk to me. And so if you've decided that you're going to do a lumpectomy or just have a mastectomy of one breast and not do both breasts for prophylaxis, let's talk about screening. If you have saved your breast, that breast undergoes mammogram every 6 months for at least the first 1 to 2 years. And the non-affected breast that stays on the annual schedule. But the point is, you're going to be getting imaging every 6 months.
Okay.
For those that are high risk, i.e., most people under the age of 40, add in MRIs also, and so those are alternating as well with the mammograms. But if you've saved your breast, or whatever, one breast, both breasts, expect imaging. And I think that's not talked about enough. Um, for those who've gotten mastectomies, you're not off the hook. And so you'll be seeing a lot of people, the medical oncologist, the surgical oncologist. And so you still should get examinations. One thing I like to hone in on, people say, okay, I'm gonna get a mastectomy because then breast cancer won't happen again. And that's not true. Have you drastically decreased the risk of it happening again? Absolutely, right? So my risk is 1%, almost 1% every single year in perpetuity until something happens. But for those who've gotten a mastectomy, especially a bilateral, your risk is around 1 to 4% over the rest of your lifetime, or over the next usually 20 to 30 years. And so the risk never goes down to zero. And I think that's just something that's very important for people to know. um, when we talk about fertility preservation, that's something that we need to know about kind of early on. And that's a discussion that needs to happen early on, just because chemotherapy can absolutely decimate the ovaries, and not everybody regains ovarian function after chemotherapy. And so that's a discussion that needs to be had almost at the time of diagnosis if you are interested in having kids in the future, so that those preparations can be made before you have your treatments. You're considered, I don't like to say cancer free, because most patients end up with invasive disease. And even after treatment, you cannot control where individual cancer cells go and what will trigger them to become active again. So I just like to say no evidence of disease. But it's pretty safe to say that after you hit that 5-year mark, the likelihood of this happening again or recurring is lower. Most people's risk is in the first 1 to 2 years, which is why I hone in on those visits and making sure patients are being seen regularly.
Okay. Okay, that's really helpful. I feel like a lot of people when they hear well, first I kind of wanted to dive into some of the reasons that you've seen people choose for the removal of their breasts and like keeping their breasts because I think um, you kind of shed light on the misconception that removing them like removes all chances of you ever getting cancer again, which is just not true. So that opens up a lot of questions between like, okay, well, even if your percentages goes down to that 1 to 4%, why keep them?
Some patients are really attached to their breasts. You would be really surprised in how just when you think about it and just the connection with femininity, who we are, how we present, how we look in our clothes, how we view ourselves in the mirror. Um, for those who want plastic surgery, you finally got the pair that you wanted. You finally look the way you wanted, and now your breasts have betrayed you. You know, your body has betrayed you.
Yeah.
Some people feel very close to them and want to do everything they possibly can to save them. Depending on the size of the tumor, how large the patient's natural breast is, there are workarounds where we can try to save the patient's breast. But I think it's important for patients to know if you save your breast, you're getting radiation, like,
Mhm.
period. So
Yeah,
you still may end up with a breast form that you don't like because radiate surgery plus radiation on top of that changes the look and the appearance of the breast for most women. And so all I can say to that is that it's just a super personal decision, and everybody has different reasons for choosing, one option over the other.
got it. Yeah. Yeah, it's interesting because I think, like, there's a logical side to this, and then, of course, there's that emotional side, and you never know how you would handle a situation if you were faced with it. Even thinking about if you want to have kids, like, some people are really excited to breastfeed and,
Yes.
like yeah, these are things that, like, they look forward to, and even just knowing that if you decide to keep your breasts, it can look very different than, like, how it looks now or what you're envisioning. And again, like we spoke about earlier, the dating aspect, I'm sure, like, I think a lot of us like to think that we don't think about, like, ho our health as it pertains to our dating life, but that's a very big reality for a lot of people.
It is, and I feel like especially for my patients who may not be married but are in relationships or partnerships, it just takes a very mature person to deal with it. Because even when you think about it, if I do a lumpectomy or whatever, the breasts are going to change. Maybe there's more sensitivity or whatever. Radiation is going to change the breast. Um, but plastic surgery is typically not a one and done thing either. That's also a process. So it's like you're damned if you do, damned if you don't, right? Because whatever you choose, there is going to be a pro and a con, and there's going to be a process involved with it. And
Yeah.
so it's interesting because I do have some patients who are like, even the prospect of plastic surgery, multiple procedures, does not appeal to them. And so there's a small contingent of patients, including patients who are young, who just say, I'm just going to go flat. I don't want to deal with it.
Mm,
If I choose to get reconstruction later, I'll do that.
wow.
But again, people choose so many different things for a plethora of reasons.
Yeah. Oh, I can only imagine, like, on top of having a team, just like a support system or a group while you're going through this, making these huge changes to your body.
Hmm. Hmm.
So, undergoing a breast cancer diagnosis and treatment can be one of the hardest things that a person can ever face. And once active treatment is over and they're no longer in and out of medical facilities, breast cancer survivors have to figure out how to start a new healing journey. What are some of your recommendations for how young people who have had early onset breast cancer can create their own toolbox and tools and resources that can help them get back to life and somehow find joy in survivorship?
So Shameless plug. I did not get paid to say this, but I love Health in Her Hue because you can find so many different specialties and really try to curate a team where you are. I promise y'all, nobody paid me to say this. I really believe it. And so many of my other sisters and other specialties who I've had the honor of knowing um, before Health in Her Hue and via Health in Her Hue are just amazing. Um, Also, there's so many other organizations that I love. I think from a mental health aspect, I'm an absolute big fan of therapy for Black girls. And so it was so nice to see Health in Her Hue and therapy for Black girls just really have this just blow up, especially during COVID when these
Yeah.
resources were so necessary. Other organizations I like, Young Survivor Coalition. Another one I like is survivingbreastcancer.org.
Mm.
Um, there's Sisters Network, which is specifically an African American based breast cancer network that's been around for a long time. I want to say almost three decades, and I believe they're based in Texas, if I'm not mistaken. But they have so many resources that are very helpful, especially for patients of color. And then another one that I really like is the Pink Fund, which
Mm.
is really helpful, especially yes, you have organizations like, Komen and American Cancer Society that help with resources, rides, things like that. But the Pink Fund also helps. And when patients need actual help, like rent is due, but I need to go to chemo, how can
Wow.
we help this patient with the resources they need so they don't get evicted? Well, because, American healthcare low key sucks.
Yeah.
So unfortunately, these are things that patients have to think about, unfortunately.
Wait, that is incredible. Again, things that you don't think about when you're thinking of life and death. Like, who
Working.
cares if rent is late? But, like, I'm also not trying to get evicted.
Mhm.
Oh, I
Can
love
I
that.
eat? Can I afford daycare for my kids if I have kids? Can
Yeah,
I what am I gonna do? The bills stack up, and
yeah.
not every hospital system. I've been fortunate to work for hospital systems that have pretty robust financial assistance programs for patients that are uninsured or underinsured, but not everybody gets to experience that and have that.
Oh, I
So
love
the
that.
people is really good about stuff like that.
Yeah, and we just dropped a few of those in the chat for anybody who needs them. Even if you don't need them, pass on those resources because that could honestly change someone's life and the experience that they're having during and after diagnosis and survivorship.
Mhm.
Okay. I did have another question for you. While breast cancer is the common cancer among women ages 15 to 39, breast cancer technically has no gender because everyone has breast tissue, which is a risk of breast cancer. Can you speak to the implications of a breast cancer diagnosis for transgender, non-conforming, or non-binary folks and what this might mean for their treatment and survivorship?
That is a good question, and that is one that um, we don't talk about enough. And so, for trans women, for example, a lot of patients end up taking hormone therapy. You're going to be on estrogen or progesterone or both. Um, as the longer you take hormone replacement therapy, your risk will go up and
Mm,
almost mirror that of a woman because most of the time you have to stay on it to maintain the features that you want. And so I think it's so important for those patients, whether it's your PCP or you decide that you're going to link in with a breast surgeon because of that slightly increased risk of developing breast cancer because of hormone replacement therapy. I think it's absolutely important. Yes, trans women can get mammograms. You
right.
know, you can. And if you've decided that you're going to do actual breast reconstruction or breast augmentation, we can still do mammograms after that. And even um, patients that are AFAB, assigned female at birth, if you have implants, you still need to get your mammogram every year. So I think that's very important to tell patients because they're afraid and say, "Oh, I won't be able to because I have implants."
Mm,
Um, and you should get them done every single year for those patients who are on hormone replacement therapy, especially when they're just starting and dealing with those new side effects, the breast pain, the breast growth, or whatever. I think is very important, especially early on, to lock in with your PCP your LGBTQ friendly PCP or breast surgeon very early. For trans men, if you still have your native breasts, you still have to get your mammograms every year until you make the decision to have affirming surgery.
Okay.
So it's so interesting. And I know we talked about this briefly before, but it's so interesting when my trans men come to me with the new breast cancer diagnosis, because sometimes, because of all the roadblocks with getting affirming surgery,
Yeah.
the relief that a couple of them have had with the diagnosis, not because they were excited about having cancer, but because they're like, wait, I can get the body I want and
Yep.
take care of this cancer, and insurance will cover it. And so these are just some of the multi-layered issues that patients have to deal with. But across the board, however you identify, please get your mammograms every year and make sure you're getting clinical breast exams by a physician every single year. And for those who are trans men, especially if you're high risk with a genetic mutation, if you still have your ovaries intact, it's really important that you continue to follow up with your OB-GYN
Mm,
or an OB-GYN that you feel comfortable with.
okay.
For those with a genetic mutation, because even though you're a trans man, you're still at risk of developing ovarian cancer.
Got it. I'm going to try really hard not to hop on my soapbox about how terrible the healthcare system is, that your patients were actually excited
Mhm.
by a diagnosis allowing them access to the body that they feel they should be in.
It's absolutely wild.
I'm gonna try that is a talk for another day,
Yeah.
but, yeah, I think that that says a lot, like, a lot about our healthcare system. I wanted to ask you, not just trans men who have had gender affirming surgery, but if you were assigned male at birth. I know we heard and we discussed this a bit the last time that we had you on a community conversation, but men in general, how often should they be checking? We had Beyonce's father get a breast cancer diagnosis, and they have breast tissue. It doesn't look like ours, but yeah, what is the recommendation there?
Well, it's kind of different because of the fact that, breast cancer just doesn't happen as often in men. They should do their self examinations also, whether you're in the shower or lying on the bed. Take a feel. It's
Mm,
so much easier for patients who are assigned male at birth, because typically there is not a lot of breast tissue there, and so it's much easier to feel versus women who have larger breast structures and glandular tissue because of breastfeeding capabilities that's been there since birth. So absolutely do it. Now, after a breast cancer diagnosis, you will be getting mammograms every year typically.
mm, okay,
The
okay,
treatment for men looks different just because there isn't much experience with doing breast conservation or a lumpectomy in a man, because you don't have a lot of breast tissue in the first
yeah,
place. And so the standard of care is mastectomy. Um, and so they deal with some of the same issues, the self-image issues, have not having a nipple and areola on one side as well. And so going through that, and am I going to do breast reconstruction? Am I going to do tattooing to recreate a nipple and areola? So a lot of the things that women go through, the men go through it as well. I think it's important for men to know that they do comprise 1% of cases. So almost 3,000 cases of male breast cancer will be diagnosed this year. Mirroring Black women, Black men are more likely to be diagnosed with more aggressive breast cancers at a later stage. And so a lot of the things that the women need to be mindful of, the men need to be mindful of too.
got it. Okay. So if you were assigned male at birth and you are a trans woman, you start taking hormone therapy, that you're saying that that increases your chances?
And
Oh,
it's
okay.
cumulative. So if you only take it for 3 months or 6 months and say, yeah, this isn't for me,
Yeah.
then like you're kind of done. But for most, trans women, they're going to be taking it
Yep.
consistently over a long period of time. And it's that cumulative effect that absolutely increases your risk.
Wow, okay. Do you know if trans women receive this like the risk information of taking some of these hormone therapies?
I I don't know. And if they do, I wonder sometimes how are health physicians and healthcare providers delivering the information, and what is the conversation around screening and things like that? Like, are you
Yeah.
making sure they tapped in with the patient?
Yeah.
Um, I just don't know, honestly.
Okay. No, that's such a good point. I feel like I mean, best case scenario, you have a culturally sensitive,
Mhm.
culturally competent provider working with you and making sure that everything else is lined up for your transition and all of the risks associated with transition. But just knowing this healthcare system, I just know for a fact that is not always the case.
Hard.
Yeah.
And you do find a culturally competent, LGBTQ friendly physician. Um, it's not like America is overrun with them,
Yeah.
right? And so, like, once you know that somebody is LGBTQ friendly or just extremely culturally competent, their schedules are just insane or whatever. And so just getting around to all the patients, is there a wait list? How long does a patient have to wait to see? I mean, and then word spreads fast. If a patient has received good care, they're going to tell their community, they're going to tell their friends and say, no, you need to go to Dr. Smith or Dr. whoever, Dr. Gore, well, like whatever, because they're going to actually listen to you and take care of you. And so it's just a kind of not a vicious cycle. It's a good thing when you find a physician who's going to do that, but
It's hard.
it's hard from a scheduling standpoint also.
Yeah. Yeah, and also depending where you are in the country and
Here, right.
oh,
It's
okay.
hard. It's easy in, Atlanta, LA, New York,
Yeah.
DC, Chicago, but it's the rural areas and the much smaller areas also
Yep.
that have a problem.
Yeah. Okay. Good to know. Well, hopefully these conversations are helpful because as Black women and trans women,
Mhm.
Black people that identify as women, there's a lot of self advocacy and self education that we have to do to navigate the system for the myriad of health concerns that we have. So, hopefully people are taking the information that we're talking about, spreading it and applying it and, you know, looking out for themselves as much as looking for doctors to look out for them.
I hope so. Like, I love these community conversations. So even if it helps only one person, I hope it's super helpful for the people that have joined in with us tonight.
Yeah, I think it is.
I think so too.
Okay, I have one more question that I wanted to get to, and then we actually have a couple of questions from our audience as well.
Okay.
So the next one has to do with skin and hair. It's no secret that hair and skin are culturally important to Black women, and these can be drastically affected when undergoing breast cancer treatment. Examples like skin dryness, hair thinning, or falling out. Can you share with us some hair and skin considerations and resources for young Black breast cancer survivors?
There are so while you're going through your treatment, number one thing that I forgot to bring up earlier is that even while going through chemo, there may be a cost associated with it depending on where you are, but you can try to save your hair. And so that's one thing I did not bring up. You don't have to be, just completely relegated to full on alopecia. There's something called the Cold Cap, and that's the brand name, but there are other companies that have come out with that also. And it's a system that you use that basically cools your scalp, cools the hair follicles to prevent them from being super affected by the chemotherapy while you're getting it. And so it's a lot, but if you feel that strongly about it, there are options out there for those who are actively going through treatment who want to keep their hair. Also, over the years, I've met people who've donated wigs or have helped with that for patients realistic, beautiful wigs too. And so that is something to think of. And I just implore patients, I think uh Black women have done a phenomenal job on this because we know how serious our hair is. And so all the companies that exist um, for healthy hair products that don't have the sulfates, don't have the phthalates, don't have the parabens and the other things that we think of that we don't want in our hair care. And this is important for y'all to know because a lot of these things mimic estrogen.
Mm.
And increase the risk of developing breast cancer because of the fact that it mimics estrogen. And so these things can get into our system, get into our bloodstream, and there's always concerned about whether it's increasing our total estrogen levels. And so one company that I love, and it was actually started by a woman who battled breast cancer, and she has unfortunately passed in the last few years, but a great hair care line, Thank God I'm Natural, TGIN.
Mm.
And I had the pleasure of meeting her. Another organization that I worked with in Atlanta, Painted Pink for Breast Cancer, and their focus is solely on young survivors. And they do things like goodie bags, visit them in the hospital, things like that. They partnered with TGIN also, and her products are very good. And the company has stayed true to that. What else? I learned the other day through my Health and Her Hue peeps about Aveeno having a whole cancer line. That was like some serious news to me. And products, restorative products for patients with very sensitive skin. And so I think that link is going to drop in the chat also super soon.
Yeah.
But yeah.
Oh, okay. Another win for Aveeno. I'm not gonna lie. Like, we just had a whole community conversation with them. I did some exploring on their website, and I also was shocked that they had a whole like skin therapy line.
That's wild to me. I
Yeah,
didn't know. I did
like
not.
okay, got it. Like y'all, yeah, okay. We did just drop a lot of links in the chat. I actually saw the cold cap on TikTok randomly. I don't know if like it saw me prepping for this conversation or whatever, but yeah, I saw it and I was like, wait, I always thought you had to let go of your hair. I didn't realize that like people were really developing technology to let you live and survive with cancer without having those major cosmetic changes.
Mm-hmm.
That is really cool.
I know it's been fabulous. And my patients that use it, they love it.
Mm.
They're able to save their hair.
And I'm a huge advocate of the wig game. Like I like I just feel like it's like, I don't know, if you have to lose your hair, you get to try out any style you want.
I'm
Like,
trying so much new hair, you know? So
yeah.
the wigs are, yes, these are not your grandmama's wigs. Some of these wigs
No.
out here are fabulous. Yeah.
Yeah, with like a 30 to 45-minute tutorial attached to it. But yeah, no lace, like you what lace, you can just like yeah, I've definitely me and my friends have actually been low key trying out wigs just to like I swear just to like protect our hair.
Yeah.
Again, another conversation, but yeah, it's just like these wigs are really good. It is not at all the drugstore wigs
Right.
that we think of.
Party wig. This is not a Party City wig.
No, it's not.
Yeah.
Okay, so we have like 7 minutes left.
Oh
We have
gosh.
some really good
Wow.
questions.
Okay.
Yeah, time flew. I wanted to make sure we got at least like through a good portion of the questions I had.
Yeah.
But yeah, I feel like anytime we talk about this, like
We
time
just go on and on, right? I
yeah.
know.
Yeah, I'm glad that we had I don't know, I can't remember if this is part 2 or part 3 of our conversation, but like I'm so glad that you're back for another segment of this.
Me too. I love doing this.
All right. So before we start preparing for 3 or 4, conversation 3 or 4, we do have a question. Sorry if I missed this question. Thoughts on genetic testing and missing breast cancer signals?
I think that genetic testing is absolutely necessary. Um, I have a contingent of patients who just don't know their family history. If you don't know, everybody's gone. Nobody wants to talk about it. get genetic testing. If you
Yeah.
have a breast cancer diagnosis, your physician should be offering breast cancer. They should be offering genetic testing. If you've had genetic testing and it was like 10, 15, 20 years ago, repeat your genetic testing because the
Mm.
old genetic test used to only look at BRCA1 or BRCA2, but now we know that there are a ton of genes. The new panels look at 50, 60, 70 genes, all that contribute to breast cancer risk. So I'm a huge proponent and I offer it to every single patient.
Oh, nice. Okay. Yeah, I do remember us kind of talking about this like genetic testing in our last conversation. So I think we did go way more into detail there. And since we don't
Yeah.
have time today, definitely
Oh,
like,
if you're adopted, get genetic testing.
oh, yeah. 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 Okay. Yeah. I mean, there's a lot of testing I think I would do. I mean, even growing up in a Black household, a lot of us don't really know, like, what
Right.
our parents were dealing with anyway. So, yeah,
Right.
totally agree. Okay. What does egg preservation for young breast cancer survivors look like, and is it different from egg preservation for non-survivors?
Wait, say that again. I'm
What
sorry.
does No, no worries.
You had like a blip.
Okay.
Okay.
Okay. We're hitting, like, that attention span marker. I think it's, like, 45 minutes or something. Um, what does egg preservation for young breast cancer survivors look like? And is it different for egg preservation for non-survivors?
No, the process is actually the same.
Hmm.
Process is the same. The issue is that non-survivors, they actually get it brought up all the time. And what's funny is why don't we bring this up with young newly diagnosed cancer patients? That's what's weird to me, honestly, but the process is the same. It's just that we go ahead and get it done very early, very soon after diagnosis so that treatments aren't delayed.
Okay.
And another
And oh, go
oh,
ahead.
I was going to say another thing we didn't touch on, but something that impacts young survivors is that they're more likely, we don't talk about pregnancy associated breast cancer often, but more likely to get diagnosed with breast cancer during pregnancy with all the high circulating hormone levels. And so
Oh,
a lot of my patients who get diagnosed with breast cancer during pregnancy are in their 20s and 30s. That's another
interesting.
topic today, but it happens.
Okay. Interesting. Okay, so I wanted to like kind of circle back to the genetic testing. If you decide to preserve your eggs, are
Mhm.
you doing genetic testing or do you have the option to do genetic testing? Can you tell that the if those eggs have a likelihood of getting breast cancer or what does that look like?
So it especially they do testing on the embryos anyway.
Oh,
And
okay.
or I know at least you can request that,
Okay.
but especially if you have a genetic mutation, if I went through egg preservation and created embryos, I would absolutely be testing every last one of my embryos to make sure
Yeah.
they don't have a genetic mutation.
Yeah. Okay. Yeah.
Absolutely.
Yeah, because I feel like and to your point, it is weird that they don't talk about it for people that have been diagnosed with breast cancer, because as soon as I turned 26, that's all anybody was talking about. At 26, they were
Mhm.
like, "So, like, if you don't plan on getting married and having a baby in the next few years, you should really look into preserving your eggs." I'm like, "I'm
We
26."
don't talk about it
Yeah.
in cancer patients, nor do people offer it. And is some of it the bias because you can't even believe that somebody under the age of 40 or 45 could get cancer in the first place when technically they should still be super healthy? Like,
Mm,
what is it?
yeah.
Like,
No,
there's a lot of bias involved in that. It's
yeah.
weird.
That is very strange. Or maybe, I mean, again, not to be morbid at all, but I don't know if it's like when people hear cancer, they like stop thinking about like the next few years, or like when they think of cancer, they're only going through the routine of what an older person might need to think about with a cancer diagnosis. But we just spent nearly an hour talking about how after you survive cancer, you literally still have the rest of your life and all of the plans that you had beforehand.
You do, and most people are going to do well and they are going to survive. So why aren't we more strategic? Now, I didn't deep dive into statistics or whatever. So the numbers for Black women compared to white women, stage for stage and age for age, are worse. So, for example, overall, our 5 year survival is like 83 or 85% versus 93, 94% for white women. But still,
Yeah.
4 in 5 people are going to still be alive, regardless of stage, 5 years from now, you know,
Wow.
like overall. Now, when you break that down according to stage one, stage two, stage three, and of course, stage four, those numbers begin to dip when you tease it out. But overall, your breast cancer patients do well across the board, regardless of race. And so these are conversations, especially when somebody's diagnosed early, that need to be had.
Yeah. I'm so glad we had this conversation. And those statistics, they give me a lot of hope. Like, so I'm very glad that we talked about what life looks like after
Mhm.
a diagnosis, because that is incredibly important. But we have reached a full hour, like, which is hard to, it's mind blowing.
Yeah, no, there's so many questions. That's crazy. We're gonna have to find a way to answer these questions at some point.
Yeah.
But yeah.
Yeah, we're definitely gonna have another conversation. I think that there's a lot to be talked about, not just about diagnosis, but as proof of tonight's conversation, all of the other factors that come with a breast cancer diagnosis. But that's it for me tonight. Thank you so much again for coming back. I'm so happy to have you. It was great talking to you tonight.
Girl, it's always my pleasure. You know, I love when we do this also. And of course, I'm super grateful to Health in Her Hue and just the entire community for everything, for embracing me, for allowing me to do this. So um, I'm super grateful.
Well, thank you everyone for joining us in tonight's community conversation. Be on the look for another one later this month and make sure to follow Dr. Gore. We're going to drop her information in the chat so that you can pass on any remaining questions that you have for
Now
her.
I'll be better at posting. I'll start posting more often again. I
Yeah,
slipped.
we
I'm
chatted
back.
about it a little bit. It's a
I'm
full-time
back.
job, honestly. So well, we are happy to have you back, and make sure that you check out all of the premium member offerings that Health and Her Hue has, so that you can stay up to date on these conversations and check in with Dr. Gore even more than you did tonight. So, thanks everyone, and we will talk to you later this month.
Bye, y'all.